These days, you don't hear very often about Democrats and Republicans crossing the aisle and working together.
But it's happening now. Local federal lawmakers are pushing to get a bill for more money for the World Trade Center's health care program.
That's right. So here to tell us about it is Republican Congressman Andrew Garbarino from Sayville, Long Island. So, Congressman, good morning to you. Thank you for being here to talk about this important topic.
Good morning. Thank you very much for having me. It is a very important topic, especially for New Yorkers.
Yeah, absolutely. So you are sponsoring the bill in the House. Democrat New York Senator Kirsten Gillibrand is sponsoring it in the Senate. So tell us what the bill would actually do and why we need it badly.
Well, myself, as well as Congressman D'Esposito, another Republican from Long Island, and Congressman Nadler and Goldman from New York City, two Democrats, we joined together to fix the shortfall in the World Trade Center health program. And we're working along with Senator Gillibrand to make sure that the shortfall of about $1.7 billion is fixed, and that the first responders, the people that were there on the pile the days and weeks after 9/11, who we said never forget, we will never forget you, make sure that we actually stay true to that word, and they are never forgotten, and they get the health care that they not just need but deserve.
1.7 billion is the number you said?
Yep, that's what the estimated shortfall is.
Yeah.
You know, my predecessor Pete King, they worked on this for a long time. They thought they had it fully funded through 2090. But unfortunately, due to COVID, due to the cost of treating cancers, and a lot more people were getting sick because of how many people were on the pile that day and the week after. That there's a big shortfall, and we need to fix it, or people are going to stop getting the care they need in the next couple of years.
Well, and it was very tough the first go around just to get it approved. So some Republicans have been calling for spending restraints, especially to fight inflation that we're seeing. So this is so important for New Yorkers. What are you hearing from Republican House leadership when it comes to that 1.7 number you're throwing out there?
Well, it's not even just about New Yorkers. There are people who are getting cared for under the World Trade Center health program in every state and 434 of the 435 congressional districts. People, forget that men and women came from all over the country to help out that day, to help out in the weeks and months afterwards, to help get on the pile and clean up downtown Manhattan. And then they went home. Where people who were in the city, they moved away. So this is not just a New York problem. This is an American problem. And Republican leadership last year, it was a $2.7 billion shortfall. Republican leadership, we were in the minority. They were supportive of fixing that. We weren't able to get the full amount. We got about $1 billion. Thanks to Senator Gillibrand. She worked very hard on making sure we got that at the end of the year. But we had the support of Republican leadership last year. I expect that they will be supportive of it now.
Yeah, and you actually also wanted to expand the coverage to responders at the Pentagon in Shanksville, Pennsylvania. Tell us more about that.
Absolutely, yes, and that's the thing. They also were attacked. We were attacked as a country that day. It wasn't just New York City being attacked. We were attacked in Pennsylvania. That's where one of the planes went down. We were attacked in D.C. And these first responders were also to those sites were also getting sick. Were left out of the original bill by accident. So that is a fix that we're hoping to get done this year, as well as a couple other technical fixes and get some more money towards research, because there are cancers that we are finding in some of the first responders that we've never seen before, that are much worse than could have been expected. So we've got more money going towards research also to stay on top of it.
Important indeed, with the research component as well. So you have support from the Uniformed Firefighters Association, right, and the Police Sergeants Union, but your news release does not mention the city PBA, which of course represents the police officers. So where are they on this issue?
We are, we're grabbing a whole bunch of advocates as well as support groups. So we're in constant discussion with all sorts of groups, including the city PBA, to get everybody on board with the support of this bill.
But does it have to take some convincing for them? Are they not on board yet?
You know what? My office hasn't been directly dealing with them. It's another office in the city who has been dealing with them. So we'll have to follow up. But they've supported this, the creation of this bill in the past. They supported the funding last year. So this is just a new bill that we're just introducing today. So I don't expect that they will be opposed to this, because it will help a lot of their former members and current members. But I don't think we've gotten full sign off yet. But I expect that to happen soon.
Well, there was similar legislation introduced in 2021, but it didn't go through. It failed. So although New York senators did get in some money later in a bigger spending bill. So are you optimistic that this time around that this bill, your bill, will pass?
Yeah, look, we had the votes, we had the support in the House. Unfortunately, we ran out of time at the end of the year, and like I said, Senator Gillibrand did help at the end and got us that extra billion. But we thought we were going to get nothing. We had one. It was a Friday. We thought we were getting everything. We thought it was going to be in the omnibus bill, and by Monday it was all gone. And by Tuesday, Senator Gillibrand was able to get us $1 billion. So, things happen very quickly in D.C., but we had support of Republican leadership. It is a bipartisan bill in Congress, in the House. So I think if we can get it moving this year, I have a good feeling that we can, at the very least, get the first responders from Shanksville and the Pentagon in, as well as getting some of those technical fixes and some more money to make sure that the shortfall does not stop any first responder from getting the treatment that they need and deserve.
Absolutely, and great to see and use the word bipartisan, a rare word nowadays that we're using. So good to see you. Thank you for being here. Keep us posted on where the bill is, okay?
Absolutely. Thank you so much for having me.